Diabetes mellitus. Diabetes mellitus, more commonly referred to as diabetes, a chronic disease associated with abnormally high levels of the sugar glucose in the blood. Diabetes is due to one of two mechanisms. The early symptoms of untreated diabetes are related to elevated blood sugar levels and loss of glucose in the urine. High amounts of glucose in the urine can cause increased urine output and lead to dehydration. The dehydration also causes increased thirst and water consumption. A relative or absolute insulin deficiency eventually lead to weight loss. The weight loss of diabetes occurs despite an increase in appetite. Some untreated diabetes patients also complain of fatigue. Nausea and vomiting can also occur in patients with untreated diabetes. Frequent infections such as infections of the bladder, skin, and vaginal areas are more likely to occur in people with untreated or poorly uncontrolled diabetes. Fluctuations in blood glucose levels can lead to blood vision. Extremely elevated glucose levels can lead to lethargy and coma. How do I know if I have diabetes? Many people are unaware that they have diabetes, especially in its early stages when symptoms may not be present. There is no definite way to know if you have diabetes without undergoing blood tests to determine your blood glucose levels. There are two major types of diabetes called type 1 and type 2. Type 1 diabetes was also formerly called insulin-dependent diabetes mellitus or juvenile onset diabetes mellitus. In type 1 diabetes, the pancreas undergoes an autoimmune attack by the body itself and is incapable of making insulin. Abnormal antibodies have been found in the majority of patients with type 1 diabetes. Antibodies are proteins in the blood that are part of the body's immune system. The patient with type 1 diabetes must rely on insulin medication for survival. Type 2 diabetes was also previously referred to as non-insulin dependent diabetes mellitus. In type 2 diabetes, patients can still produce insulin but do so relatively inadequately for their body's needs, particularly in the face of insulin resistance as discussed above. In many cases, the pancreas produces larger than normal quantities of insulin. A major feature of type 2 diabetes is a lack of sensitivity to insulin by the cells of the body. Here is a simple home remedy to cure diabetes. It helps to maintain the sugar levels and at the same time, it helps in preserving the basic health of the patient. Indian gooseberry or Amla and turmeric. In the ancient science of Ayurveda, doctors often prescribe Indian gooseberry, also known as Amla. The rejuvenating fruit has many uses, among them the powerful fruit full of B and C vitamins, as well as several other exceptional phytonutrients, helps to decrease blood glucose levels in diabetics and lower cholesterol. Studies which show that Amla prevents the development of complications like diabetic neuropathy and diabetes-induced heart dysfunction in type 2 diabetics. It seems like this incredible fruit Amla has a positive effect on people with diabetes and can boost the health of the cardiovascular system too. Turmeric. Turmeric is a boon for diabetics. The antiseptic and antibacterial properties of turmeric that has been used as an old age remedy to heal various problems. Not only this wonder spice renders a unique flavor and color to the food. It has more health benefits. According to the health scientists, curcumin, a compound present in turmeric, when coupled with omega-3 fats, may delay or prevent the onset of type 2 diabetics. Diabetics and curcumin, how does it help? The root cause of type 2 diabetes is systemic inflammation, which impacts insulin secretion and function. Our aim is to stop the inflammation in the bud. The study emphasizes on the use of two bioactive compounds, namely curcumin and omega-3 fats, both of which are well-known anti-inflammatory agents that can be easily found in turmeric. Thus, turmeric helps in reducing diabetes. To make this home remedy, let us take Indian gooseberry and turmeric. To make this process easily, here we are taking Amla powder and turmeric powder. We have to take 75 grams of Amla powder and 25 grams of turmeric powder. That means 3:1 ratio. Take a bowl, add 3 teaspoons of Amla powder, and 1 teaspoon of turmeric powder and mix them well. We can keep this mixture for 3 months without losing its medicinal values. You have to take 1 teaspoon of this powder with water either at bedtime or early morning on empty stomach. After 1 hour, you can take breakfast. This not only reduces blood sugar levels, it also reduces the weakness caused by diabetes. Turmeric reduces the sugar levels. You have to continue it regularly as a part of your diet. This powder works in 2 ways. In one way, it preserves the health of the structure in diabetes, and in other side, it maintains the sugar levels in the body. So, both are important for a diabetic people. By taking this powder regularly, you can reduce blood sugar levels. Thank you for watching this video. Like and subscribe for more videos.